as a physiotherapist. I work in Melbourne, Australia, and I work for two different organisations within public health. I work for the Royal Melbourne Hospital as the head of physiotherapy research, and I also work for the University of Melbourne as an associate professor of physiotherapy. So what I do in the public health area is I work with people who have been diagnosed with lung cancer predominantly. And my role is to conduct research, looking at ways we can help people with lung cancer through their recovery. We know that there is a lot of evidence for the role of exercise training and physiotherapy and rehabilitation for people with lung cancer. And a lot of the work I've done over the last 10 years and last decade is actually generating that research. So my role is facilitating research to be done, as well as training new physiotherapists coming out in Australia, and we have many international students as well who move elsewhere around the world, to train them as well, so we can promote the role of physiotherapy and exercise rehabilitation for people with lung cancer. I've been interested in physiotherapy for almost all of my life. Initially, when I was a high school student, I was in year 7 or 8 and started being involved in a number of group sports. And in particular, the sport I was really interested in was swimming. And I was doing a lot of swimming and a lot of training and developed some sporting related injuries at that time. And so as part of my recovery, my parents took me along to the local physiotherapist in their private practice. And at that point, I'd never met a physio before. And I worked with the physiotherapist over a number of months to rehabilitate what was a shoulder injury at the time. And I really achieved very good outcomes and got back to swimming at quite a high level. And that physio made such a huge difference in my life. You know, I love sports and I love swimming. And had I not have worked with them, I may not have actually been able to get back to doing what I really enjoy. And from that time, I was at a very early age, I decided this would be a really great career for me. You're working with people, you're potentially making a big difference for people and a big difference for their lives. And I explored what it would be like to be as a physio. And then later on, when I was in high school, towards the end of high school, I realized that physiotherapy, it's a medical-based subject. There's a lot of physiology and anatomy and science behind it. And I really love those subjects at school, with the science and maths and physiology, those types of subjects. Really, I really enjoyed learning about them. So I thought, physio sounds like a perfect degree to study at university. So I sort of turned my attention to getting into physiotherapy. And at the time, I got into the University of Melbourne in the Bachelor of Physiotherapy program. And it was a great career choice. I love learning about physiotherapy. Like I mentioned, love the anatomy and physiology and the science behind it. And even more so, I love the evidence base behind it. There's such strong evidence behind everything we're doing with our patients. And it's turned out, it's turned out fantastic for me. I love the profession. I'll always be a physio. Love working with people every day to try and help them with whatever it is we're working with, their injury or their condition or their recovery. But I also love generating research to help inform other physiotherapists, so we can treat our patients to the best of our ability and improve the outcomes for them to the best that we can. Physiotherapy is a profession that's based around evidence-based practice. So most of what we do as a physiotherapist is supported by research. And you would be surprised to know, but if you're seeing a physiotherapist in a private practice or seeing a physiotherapist in a hospital, that most of the treatments or assessments they're doing are actually supported by research. So I work in a large public hospital, the Royal Melbourne Hospital in Melbourne, Australia. And the physiotherapists there are working with patients every day, but also as part of their practice, we're doing research every day. And we use that research to improve our practice, to then be able to improve outcomes for our patients. So really, research and clinical practice go hand in hand. We can't have best clinical practice without the research to tell us how to make the practice as good as possible. So most of my own job is actually focused on generating research and also supporting others to do research. I have many PhD students and master's students who are physiotherapists who are coming to study with me to do research in their specialised area of physiotherapy. But that research is all very important because it tells us as clinicians out there how to best work with our patients to achieve the best outcomes that we can. There are many barriers that people with lung cancer face in terms of participating in physical activity or exercising. A lot of my research over the last decade has looked at this topic so that we can understand why people with lung cancer may be less physically inactive than another person who's the same age, living in the same area that doesn't have lung cancer. What we know and what we've found out from our research is that many people, when they're diagnosed with lung cancer, do not do enough physical activity. And then as people go through treatment, it's very common to reduce your physical activity levels even more. There are a number of reasons why this is the case and a number of barriers for people to be physically active. Some of these relate to the cancer themselves. So for example, people with lung cancer have some of the highest levels of symptoms of any type of cancer. Things that come to mind are things like shortness of breath or fatigue. And they, of course, make it very hard to be physically active if you're feeling that way. But there are other barriers as well. People who are going through treatment, coming into hospital all the time to go through chemotherapy, or people who have just had surgery and are in pain after surgery. There are lots of different factors that all interplay that mean there are significant barriers for people to be active. On the other hand, there are also barriers in terms of patients being able to access exercise programs. So we know that there's been a lot of research and evidence now supporting the role of exercise for people with lung cancer. But what we don't have is, a huge number of exercise programs out there that are open for people with lung cancer. So one of the other barriers is actually for patients to be able to find a program and to be able to access that program. And they're really not as common as we would like them to be. In my area, I spend a lot of time focusing on the role of exercise training to improve people's recovery after treatment for lung cancer. And I feel like this is an area that we really need to invest a lot of time and effort in for the future. What we know is that people with lung cancer, they can experience significant symptom burden after lung cancer is diagnosed. So people can have, significant shortness of breath, significant fatigue, bad symptoms, which make it very difficult for them to participate in their usual daily activities of daily living. And so therefore, I feel like we need to invest a lot of time and effort looking at how we can support people through their recovery with these types of rehabilitation strategies. And exercise is one of those. What we are doing in my field at the moment is we know that exercise is beneficial to improve outcomes, but we really don't understand the best way to deliver that exercise program. In recent times now, there's been a big focus on delivering care through telehealth. And so we're interested to understand whether exercise programs for people with lung cancer are effective when delivered through telehealth. We also don't understand the best types of exercises for people with lung cancer. There are a huge number of exercises that you can prescribe. There's different intensities, different durations, different types of exercises. We don't have a very good understanding of which is the optimal type of prescription. So in the next few years, over the next 5 to 10 years, we really need to focus our attention on finding out what are the best models of care in terms of exercise programs and what is the ideal exercise prescription to improve patient outcomes for people with lung cancer.